So today we're going to be taking a look at telemedicine. So just talking a bit about what it is and how you can access it. I think this is a pretty important topic right now, considering so many of us are still kind of sheltering in place or trying to only go to the doctor's office if we really need to for issues that can't be served through telemedicine. So we'll talk about some of the medical issues that you could just use telemedicine for um, and go over that. So without further ado, so as I mentioned, we're going to talk about what telemedicine is today. We will go over some of the different options. So just bear in mind that most of them will be aimed at individuals in the US, but there is one in particular that we'll take a look at for Canadians. And we'll also talk about just how to access telemedicine. Okay, so what is telemedicine? So the American Academy of Family Physicians defines telemedicine as the practice of medicine using technology to deliver care at a distance. So the physician is in one location and they use a telecommunications infrastructure, so in other words, an app, a computer, an iPad, something to that effect, to deliver care to a patient who's at a distant site. So as I mentioned, this kind of prevents you having to go into the hospital, having to stay in a waiting room, having to go into your physician's office. You can access this from the comfort of your home. So in short, telemedicine lets you see medical care professionals remotely using one of your devices. So as I said, that could be a phone, that could be a tablet, a laptop, a desktop computer, whatever you have. You can see general physicians, you can see nurses, you can see specialists as well, such as dermatologists, psychiatrists, and you could also access therapy remotely as well using a website or an app. So some of the pros of telemedicine. So as I was mentioning, especially with our current climate with respect to COVID-19, using telemedicine allows you to kind of not expose yourself to germs. You're not having to go wait in a clinic or in a hospital waiting area. It minimizes unnecessary hospital visits as well. So this might be particularly relevant to any of our Canadian members today. You know, sometimes it takes a little bit longer if you have certain complaints and you don't have a general, like a family doctor to go see. So you might have to go wait in the ER, and sometimes wait times can be pretty ridiculous. So this allows you to bypass some of those crazy ER wait times. It can also reduce medical costs and travel. So if you're in a more rural area and it takes you a while to get into the hospital or the physician's office, and this can allow you to, again, stay at home. You don't have to drive anywhere. That can be great. Improving access to care. So again, patients, especially in certain towns, you might not have access to, say, a psychiatrist or something to that effect. So allowing patients in more rural or remote areas have access to those specialists. Telemedicine can really mitigate that issue. It also allows you to have ongoing support to patients and family members. So again, you can have that continuity of care at home. Maybe you've made your initial visit to the physician, but you want to have your follow-up appointments via telehealth. So that's one pro of it as well. And then of course, it increases the chances of having that kind of independent or community home living. So rather than having to live closer to your hospital or whatever, you can still have your home out in the country and you're still able to get access to care. And something to note as well, so you can still get prescriptions through telemedicine. In many cases, at least from some of the Canadian sites I looked at, the exception would be for controlled substances, so some painkillers. So some specialists can prescribe those in certain cases. What they would do is they just fax your prescription to a local pharmacy right away. And you can also get doctor's notes this way as well. So something to bear in mind. So those are some of the pros. Let's take a look at the cons. So of course, if you're using telemedicine, you're talking to someone through a webcam, your physician won't be able to really do a physical examination. So for certain complaints, they might not be able to really diagnose that way. It's not suitable for all cases. So again, kind of in the same vein as the limited physical examinations, there'd be certain complaints that a physician just wouldn't really be able to address over telemedicine. And obviously, of course, also for emergency reasons, you're going to have to go to a hospital anyway. Anything that's emergent will definitely need to be in person. Another important consideration is technical glitches. So, you know, we all have them, whether you're involved with cyber seniors as a mentor or as a senior, you're probably going to run into technical glitches at some point. So that could potentially have an effect on your ability to meet with your physician. Also, something to bear in mind, not all physicians offer telehealth or telemedicine. So you might not be able to continue with your primary care provider if they don't offer it. And then as well, there's that requirement for the patient to learn how to use telemedicine websites and applications. So again, kind of in the same vein as technical glitches, this could potentially be an issue as well. And also something that I'll note, typically you can't get referrals to specialists. So if you're just wanting to meet with a physician online so you can get a referral to a specialist, you might not be able to do that using telemedicine, but you would be able to get like lab work done and whatnot. They just can't refer you out to other specialists. All right, so that was some of the pros and cons. So let's talk about when you might want to consider using telemedicine. So generally speaking, for anything that's less severe symptoms that can be assessed through like a computer screen through your webcam, as well as follow-up assessments for ongoing health concerns, that could be covered by telemedicine. So we'll just go over some examples here. So anything like chickenpox, like canker sores, if you have pink eye, something like common cold, flu, and allergy symptoms that you can easily describe over telehealth. Anything related to digestive issues, well, not anything, certain things related to digestive issues, coughing or sore throat, fever, headaches, including migraines, heartburn and GERD, insect bites, minor injuries such as sprains that you wouldn't necessarily need an immediate physical examination or x-ray for, painful urination, rashes, and other skin conditions. So these are all appropriate symptoms that you could take to a doctor using a telemedicine platform. For symptoms beyond these or more severe symptoms, you should consider seeing a doctor in person or making a visit to the hospital. So just bear that in mind. So here's a list of some telemedicine providers. So these are all websites or applications you could get on your phone, tablet, computer. So we're going to look today at MD Live, but just bear in mind for our Canadian viewers today, Maple here is the only one directed at Canadians. So everything else here is for US clients or patients. There's different geographical limitations as well. So like I was mentioning, again, you can only use Maple if you're Canadian. And then all of these platforms should be available both on the computer and on phones and tablets. So depending on which device you're using, you can download the app on your phone or you can access the website on your desktop computer or laptop. All right, so on your computer, so if you want to access any of those aforementioned telemedicine platforms, what you would do is use any web browser. So whether it's Microsoft Edge, Firefox, Chrome, Safari, anything in between. If you're on a Windows computer, you're probably using either Edge or Chrome. If you're on an Apple computer, you probably have Safari. So whichever one you decide to use, you could type in the name of the website into Google or into your search bar and access it that way. Or if you know the website URL already, you can just pop that in, but you would just navigate using your browser. And then if you're trying to access telemedicine on your phone or tablet, so rather than navigating to the website, you would want to get the app. So you would go to either, if you're on an Apple device, you would go to the App Store with that icon right there in the middle there. Or on an Android device, you would want to start by opening the Play Store. So then once you're in the store, you would type in the name, either MD Live, for example, or Maple, or whichever one you decide to go with. You type that in, the app should be there in your search. You would download that, install that, and access it through the app itself. All right, so if you would like to see your current primary care doctor using telemedicine, you'll need to get in touch with them and ask them if they're set up to handle online appointments. So this really depends, again, on your physician. Not all doctors are online, and if they are online, they may not be on one of those sites. Sometimes, like for example, they might just call you up on the phone if you have an appointment with them. I would call your clinic and just see what they're doing, if they are using these platforms, if they are just using kind of call you up on the phone, in which case you don't really need to download any apps, but you would need to contact your primary care provider to determine that. So we're going to just take a look at the sign up process for MD Live. So as I mentioned, this is for US patients only. So if you're Canadian, this might not exactly apply to you, but the sign up process is very similar to what you would see on, for example, Maple, which is the only Canadian platform that I'm aware of for telemedicine. So just bear that in mind. So for this example, we're talking about using this on your desktop or laptop computer. So you would open up your web browser and you would type in mdlive.com into your search bar at the top, and you would navigate to the MD Live website. So you would at this point need to create an account. So you'd click on the Get Started button here. And at that point you need to input some personal information. So as you see on the screen here, your first name, last name, email, date of birth, all that good stuff. So that is how you start creating your account. Once you have created an account on the website, that's when you get into setting up an appointment. So something to bear in mind, this is not free, whether you are Canadian or American. There is a cost associated to using telehealth platforms such as Maple or MD Live. It might be covered by your insurance. You'll need to check in with your actual insurance to determine that and see if there's any provisions that they have for telehealth. So once you've created your account, you can now, like I said, you can choose what type of appointment you're looking for. The costs tend to vary depending on whether you're seeing a specialist or not. For example, psychiatry visits, especially the first visits, tend to be on the higher end versus just seeing a general physician would be kind of on the lower end. And so just bear in mind that there could be differences there. There's different pricing on Maple. We can take a look at that later for any of you Canadians to kind of see how they structure their payments, but just bear all that in mind. So you can choose which service you'd like at that point and schedule your visit. So when you're scheduling a visit, you need to basically state the reasons for your visit. So they might give you some options, some easy click options to select from. They might ask you to kind of type in your complaints. So that's pretty standard. The system will then continue to kind of give more in-depth questions to kind of find out some of your general health history as well. So this could take a couple minutes. So you see here, this is just putting down the reasons for the visit. They'll probably go on to ask you kind of what drugs you're on, some of your pre-existing health conditions. That's kind of standard thing that you would fill out on a form if you go to a physician's office. You might be required to provide a photo depending on what your complaint is. So it's not necessarily required, but like, for example, if you have pink eye or something and you want to show what your eye looks like, you could either upload a photo from a phone or from the device you're currently using. So for example, if you're on the desktop and you have the photo saved somewhere on your computer, you can upload it from your computer. But yeah, that just kind of helps the physicians so they kind of have an idea of what they're looking at, and it might be easier to see in a photo versus on webcam. So keep that in mind too. All right, so as I was saying, it'll ask you to fill out your health profile. So it's going to ask you things like if you have any drug sensitivities, allergies, are you taking any medications? Do you have any other health conditions? As I said, these are pretty standard questions that you would get at any clinic before you're starting with a new physician. At that point, once you've filled out all your health history and why you're there, they will ask you like appointment time and which physician you'd like to see. So I believe for Maple, and it might be similar for MD Live, you don't necessarily get to pick which physician you would like to see. But if it's something requiring continuity of care, so for example, if you're seeing a psychiatrist, you would be able to specify and schedule like that specific physician for follow-up. So just bear that in mind as well. But yeah, so depending on who you're seeing and depending on whether you're looking at, say, an evening time slot versus afternoon versus weekend, it might also change the price. I noticed on Maple, if you're looking at like a weekend or an overnight time slot, it might cost a little bit more for that appointment. So that would be all laid out on the pay page. but just wanted to mention that. So yeah, so you'd schedule your appointment here. You might have the option to choose the language that you'd like your physician to speak, sometimes maybe gender, speciality, so you can do all that here. And then you can also specify if you'd like them to call you on the phone or if you'd like it to be a video appointment. So obviously if they're calling you on the phone, it's just going to be audio. If it's a video appointment, it might be through not Zoom per se, but some kind of similar platform. All right, so after you've gotten all that done, you've scheduled your physician in, all good to go, you'll be taken to the payment and insurance page. So as I mentioned, some insurances do cover telehealth. So again, whether you're American or Canadian, you'll need to check with your insurance provider to determine that. So you would fill out your payment information and your insurance information on that page. And at that point, they'll store your information in the system. So bear in mind, there are a lot of laws in the US. I believe it's HIPAA. In Canada, I cannot recall what ours is called, but there's a lot of confidentiality laws around ensuring that any protected health information is under a lot of encryption, that they're making sure that they're storing it such that nobody has access to it that should not have access to your file. So in terms of privacy, as presuming you're using something like MD Live, like Maple, like any of the other applications for telehealth that we've mentioned in this presentation, your health information should be secure. So for anyone who's kind of thinking that in the back of their head, that should not be an issue. There's quite a lot of privacy laws to protect you surrounding that. So all right, so at that point, you would be scheduled for your appointment, and you'll be directed by the site on how to contact your doctor or if they're going to call you at a certain time. And as I said before, at this point, you've either specified it to be a phone call or a video call, so they will provide further information at this point. All right, clicking next. Okay, so some things to remember. So as I was mentioning before, not all of the apps are going to look exactly the same or offer the exact same services. So for all you, for everyone here who's American, you're gonna have some more options. So MD Live was just one of multiple examples. So you might want to compare the different options out there, compare pricing, compare you know, how their services work and kind of decide at that point. You might also, depending on which state you live in, only have access to certain physicians or certain platforms. So just keep that in mind. Similarly for Canadians, depending on which province you're in. So for BC, apparently, I don't know if anyone here is from BC, but they actually do have coverage for telehealth just under their provincial healthcare service, the MSP, I believe it's called. So bear in mind, depending on which province you're in, you might get different service and different coverage. So that should either be outlined on their facts page or something that you'll have to look into and investigate yourself. So make sure that you, of course, do your research before choosing a site or application that you want to use. So see what they offer, see what's covered, see if you're in the right geographic location to use it. Google should be also a really great resource to read articles and kind of learn more about the different companies and figure out which one is going to be best for your specific needs. And again, as we said before, these apps are great for minor symptoms, and they can be a really good option if you're having difficulty going out and seeing your physician due to geographical limitations or what have you, but they are not necessarily going to be appropriate for all your medical needs. So even if you're able to do some follow-up appointments with your physician for one complaint, you might have to still go in for something else. So this is not meant to like replace going to your physician's office. It's just meant to be something that increases your access to healthcare, but I don't think we can avoid in-person visits at this point. So all right, so if you're interested in learning more about this new form of patient care, we have a link here. So again, anyone who's in this presentation, like don't scramble to write this down, you will get the link to the presentation later on, so you can go through and click that link there. So it's just gonna give you some more information about telemedicine and kind of how it's evolving. Then as well, there's a link here to Healthline that gives the top rated telemedicine apps. I believe that's probably going to be specific to Americans. I'm pretty sure our only option up here in Canada is Maple. So bear that in mind. But yeah, so these links will be sent along with the video link later, so don't scramble to write those down. All right, so as I was mentioning, we just have one option up here in Canada called Maple. The Maple website is just getmaple.ca, so that's how you can navigate to that. I just wanted to really briefly show you what the Maple website looks like. So again, this is for us Canadians. So there's an interesting page that just talks about how it works. So this can be really good to kind of familiarize yourself with just how telemedicine works and how Maple specifically works. So Maple is just a platform. The physicians that work there, like they don't actually work for Maple. They're just kind of contractors, or they just use Maple as their meeting platform, kind of like how we use Zoom as our meeting platform right now for cyber seniors. So bear that in mind. They're not employees of the Maple website. But it kind of breaks down how you can request a consultation in Maple. So it would be very similar to what we saw with MD Live there. So you would describe yourself, describe your symptoms, you would go into payment, and then into basically booking your meeting with that patient or with that physician. So very, very similar process there. So at that point, once you've got your appointment booked is when you would hear from your physician. So once the doctor reviews your request, they'll basically determine whether or not they can help you, and then they'll be in touch with you to confirm that appointment. So at that point, you would decide if you want phone or video, etc. So yeah, so that's kind of a breakdown of Maple. It's got some frequently asked questions at the bottom too, which is really useful. So I really encourage you, anyone who's kind of curious about this and up in Canada, to check out their website. And it's definitely great. I know, again, living in Ottawa, sometimes if you have a complaint, something as simple as a sneeze or something, or you got allergies, if you don't have a primary care physician, you're probably waiting like 5 hours at our hospitals here. So this can be a really great way to not have to spend 5 hours in the ER, especially right now, and maybe being in the ER and exposing yourself to potential, COVID-19 or whatever else is going around right now might not be in your best interests. That's really great. And also for certain specialities that might take you forever to actually see a physician on. So for example, psychiatry, which I know can take like 3 years sometimes to get in with a psychiatrist, you would be able to access that much more quickly using a telemedicine platform like Maple. So I encourage you to check that out if that's of interest to you. There's some interesting kind of pricing plans here, so you can pay per visit. They also have the option of medical membership plans as well. So you pay per month, and then depending on, if you want to see your physician once versus 3 times, there's kind of some flexibility there. And then there's like credit packages as well. And again, this might be covered by your health insurance. So that would be something that you'll have to investigate on your own. A couple other things for Canadians. So there is something, if you're living in Ontario, there's Telehealth Ontario. If you guys have heard of that before. So basically you call in and they'll connect you with a registered nurse and you can ask them medical questions, but that doesn't replace a doctor's visit. And so they can't give you any diagnoses or prescriptions, but that can be good to kind of get an idea of, should I go to the ER or should I just schedule an appointment with my physician? So that's one resource that we have here. There's also, like I said, for people in BC, there seems to just be like a lot more telehealth options. So you actually have free access to video visits through your healthcare plan there. So you can check that out. Just look up, if you even just Google like BC residents telemedicine, there's a bunch of resources there for that. So that's something to check out. But yeah, so I think that's a pretty base level coverage of sort of the options we have in the States and Canada.